Hi, this is Dr. Gombele from drg.com. Thank you for coming to our another presentation on health series. I would like to thank you for the support that you have shown on my morning watch, on my morning walk with Dr. Gombele, and then many people like it. That's just another way to keep you busy and also to advise you that you need to do some kind of walking. Alright? Today we are going to start presentation number 2 on diabetes complications. And it is a very interesting presentation because it talks about strokes. Strokes, it's one of the complications of diabetes patient. I mean that if you are a diabetic, you are prone to have stroke than a person who is not. But only when your sugar is all over the place. But if it is controlled, you are just as any other person. So what is a stroke? A stroke occurs when there are two things. Either reduction of blood flow in the brain. When I talk the brain, look at my head. Inside the head, there is something called brain. And this is the skull. So whenever I say brain in the head, right? Stroke occurs when there are two things. One, reduction of blood flow to the brain. Two, interruption. By interruption, there is completely no blood flow, or there is a decrease of the blood that flows into the brain. We said earlier that within the blood we have nutrients like vitamins, minerals, we have hormones, we have oxygen and glucose, and the brain needs those to do its functions. Brain is very busy place in the human body. Brain consists only of 2% of normal human body weight. That means if you normal body weight is 160, so your brain like 2% will be like 3 pounds. 160 pounds, 2% will be like 3 pounds. But interestingly enough, that 3 pounds organ requires 20% of all your glucose that you consume and all of your energy. And it also requires 15% of all the blood that goes into your veins. That means it's a very active place, and so it needs the energy to do its functions. If you have an interruption of the blood flow in your brain for 10 seconds, you have a loss of consciousness. For 1 to 2 minutes, your brain starts malfunctioning. 3 to 4 minutes, your brain is irreversibly damaged. That to tell you how the brain really needs the blood. I would like to remind us a little bit of the functions of the brain. In fact, brain control human being. All the organs in the body depend on the brain to function properly. Like sense of touch. For you to feel like somebody is touching you, the brain must be working properly. And to react to the touch. If somebody pinches you, you pull. If somebody rubs you nicely, you relax. You feel nice and relaxed. All these are brain functions. To differentiate the shape of the object, the size, the colors of the object, we need a brain. To breathe, even though it's involuntary, the involuntary action that we do, you sleep, you still have to breathe. You sleep, your heart still needs to beat. So brain is behind sleeping, attention, concentration, heart rate, sleep and wake, memory, to store things in our memory, to retrieve what we store in our memories. Understanding languages, interpreting languages, the brain is behind. Hearing, the brain. Balance, coordination. And sometimes we ask patients, close your eyes, try to walk. They cannot walk. You know something is just not right with the brain. Vision, right? And then in every area of the brain, there are functions for that area, all right? And if stroke hit one specific area, that means the function performed by that area is going to be affected. I just want to tell you what somebody wrote about the brain 2,400 years ago. He says, men ought to know, this is the man, he said that from the brain, and from the brain only arise our pleasures, joy, laughter, and jest, as well as our sorrows, pain, grief, and tears. Through it, through the brain, in particular, we think, see, hear, and distinguish from beautiful, distinguish the ugly from the beautiful, the bad from the good, the pleasant from the unpleasant. 2,400 years ago. His name is Hippocrates, who is now considered as the father of modern medicine. How many types of strokes do we have? We have 3. All right? One is called ischemic stroke. That means the area is deprived from oxygen, or hemorrhagic stroke. The vessel burst, rupture, and the blood start. The vessel start bleeding in the brain. Or minor mini stroke. We call it TIA, transient ischemic attack. This one comes and less than 5 minutes it goes away. You feel numbness on one side and it goes away. All right. So these 3 are the types of strokes that we know. In medicine, we always like to talk about the risk factors. Risk factors are the conditions that you have, and the more of those conditions you have, you increase the chance, you increase the probability of developing a disease. And stroke is not an exception. It has its risk factors. Risk factors number 1, high blood pressure. High blood pressure is the leading cause of stroke, right? If somebody had a stroke, you say, more likely the person had what? High blood pressure. Risk number 2, cigarette smoking. It affects the vessels, it affects the arteries, right? It's a high risk of developing a stroke. And then diabetes mellitus. The fact that you are diabetic, you stand a higher risk, higher chance to develop a stroke than a person who is not. But if your sugar is always under control, your weight under control, you diet, you exercise, you just are like anybody else. High blood cholesterol is another risk. Heavy drinking, another risk. Diet low in vegetable and fibers, another risk. Lack of regular exercise. You must have been hearing so much about exercise, not only for diabetes. Exercise also, lack of exercise, it's a risk to develop stroke, obesity, and some of the heart diseases, right? Remember, stroke is a lack of blood flow in the brain. And we are just saying condition that can push you to develop, to have a stroke. So you don't have a stroke, but more of this condition you have, you can develop a stroke. Age is another risk factor. As we grow, things like shrinking, people say race, but I doubt it. It's more like lifestyle. Sex, yes, because female, before the menopause, they don't really develop stroke that much. But after menopause, the risks shoot the roof. And some hormone like family planning that can also predispose you to develop stroke. So how do you know that a person is having or has a stroke already? Trouble speaking, all right? Difficult speaking. Not only they cannot speak, but they have problem to comprehend what we are talking to them. When they come to the hospital, I ask, how are you? You see, they are thinking. I said, who is this standing before you? Maybe the husband, the son, or they don't know. They look like it's a stranger, right? And they feel numbness on one side of the face, right? This is the most common. Numbness on one side of the face, weakness on one side of the arms or legs, right? And you ask them, raise up your hand. The hand will stroke always down. Smile. They cannot. The face twisted. You give them your hands and say squeeze. The side that has stroke may not be able to squeeze, but the side that doesn't have a stroke will squeeze, all right? And you tell them, get up and walk. You will notice that they are dragging one foot, right? That is the side that they have stroke, right? So the face, the arm, the legs, and then problem seeing, because we don't really see by our eyes. The brain is that facilitates the vision. Occipital, behind the head, that area of the brain is responsible for the vision. And if stroke did occur in that area, you cannot see, right? It can be on one eye or on both sides. Headaches, right? Trouble walking, as we say. And there's a word that we like to use, fast, right? Fast stands for face. Any change in the face? A stands for arms. Weakness in the arm. S stands for speech. When you see these three in one person, and then use T, you call the hospital. You call the ambulance. That means there is a stroke. Because there is another medical condition that affects your face called Bell's palsy. It just affects the face. In the hospital at work, we get referrals from all over the place. And some referrals will come like stroke. Yes, it looked like a stroke. One side of the face twisted. But when I ask them, raise your hand, they raise the hand way up. I say, squeeze my hand. Oh, no. They really want to break. I say, no, wait. But then I say, close your eyes. One eye cannot close. That is like Bell palsy, a nerve problem. But we still have to rule stroke, so we keep them in the ward, and the specialist will sort them out. So to diagnose a stroke is not difficult, but because once we have the clinical signs, then we do the ECG, we do the X-ray, sometimes we have to do the echocardiogram, we have to do the scan, the MRI, the blood works, and then we diagnose the stroke. To treat the stroke is also to treat the cause of the stroke, right? Pressure high, when you come out of the hospital, they'll warn you, keep your pressure down, right? But I'm not here to tell you to go and we're going to treat your stroke. I want to tell you to prevent. But before I conclude, I want to invite you to do what? To like, to share, and to subscribe. Do not forget to click the notification bell so that when I upload my very next video, you will be notified. Many people are asking me, what do they need to do to subscribe? And I understand the age group of our subscribers, but you go to YouTube, in the barcode of YouTube, put Dr. Gombele, Gombele, and you punch, you're going to see all my video. You're going to see on red, subscribe. You touch the red thing, then you will become a subscribed member, right? If you don't know any other, or you have a little daughter or son, the experts on YouTube, they will help you to subscribe. Prevention is what I would like for us to take home. How do we prevent stroke? Well, as listed earlier, try to work on them. You have high blood pressure, try to control your blood pressure. You are diabetic, control your diabetes. You are overweight, work on the weight. You smoke, quit, right? You drink a lot, discontinue drinking. We cannot stop aging, but we can age with good health, right? You don't exercise, put exercise in your daily routine. It's a regular, not sporadically, regular exercise will help you to prevent the stroke. Sad here is that 80 to 85% of all the strokes could have been what? Prevented, right? So I want to leave you with prevention, that treatment. The complication, I don't even want to go there. We have to put the NG tube, bed sores, sepsis, lung infections. So I don't even want to go on complication. And sometimes are complications that kills them. There are complications that kill them. Not a stroke, you know, but they cannot swallow because the muscle responsible for swallowing get weak. When they swallow, the food goes into the lung, infection, the bed sores, and then when they urinate, all that. So it just don't let us go there. Let us deal with the prevention, and I want you to know the risk factors, work on your risk factors, and then you will stay away from stroke. Mon amboka, au revoir, hasta luego, see you soon. So subscribe, like, share, and do not forget to click the notification bell so that the very next video I'm going to upload, you can get it. God bless. Hasta luego. Bye-bye.